thank you for joining us live tonight. Out of our deep respect for Indigenous peoples in Canada, we acknowledge that the Canadian Premature Babies Foundation is situated upon traditional territories of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat peoples. We also acknowledge the land covered by Treaty 13 is held by the Mississaugas of the Credit First Nation. We also recognize the contributions and enduring presence of all First Nations, Métis, and Inuit peoples in Ontario and the rest of Canada. We are grateful to work on this land. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and a mother of a surviving twin born at 26 weeks. Today, we celebrate World Prematurity Day, and we prepared a very special Preemie chat with clinicians and NICU parents. I want to thank Pampers Canada for supporting tonight's session and for believing in our vision of a brighter future for all premature babies and their families. Stay tuned as we will have a special announcement tonight. This evening special edition is focusing on NICU parents' mental health. Research has shown there are many challenges of preterm birth for both babies and families. Prematurity is the leading cause of infant death before the age of 5 and the leading cause of childhood disability. A baby born preterm can have short and long-term complications. As a result, parents have to deal with medical challenges, readmissions, which impact the family dynamics and functionality. Each event that demands medical or nursing care can trigger a reminder of the original NICU trauma and fear. Mental health can be significantly impacted with each trigger. While the system is more equipped to provide support and resources for the babies, parental mental health and well-being is still not widely recognized. CPBF, as a parent-led organization, was founded on the needs to address all areas of preterm birth and ICU admission following discharge. As Preemie parents, we know firsthand the result of early delivery and the impact it has had on our mental health. Today, we have raised awareness about prematurity. Tonight, we are going to focus on mental health as it impacts families who have had babies in the NICU. But what we need to know and what can be done. I have the honor to introduce you, let me bring him to here, to introduce you to our first guest tonight, Dr. Deepak Lewis from Winnipeg, Manitoba. He will focus on the type of mental health issues that are common among parents of children born preterm, how they evolve with time, and some of the potential strategies to tackle them. Dr. Lewis is a neonatologist and assistant professor of pediatrics and child health at the University of Manitoba. He's a clinical researcher at the Children's Hospital Research Institute of Manitoba. His research program aims to study the impact of prematurity on the long-term outcomes of children and their families, including siblings. He's specifically interested in the mental health of parents of preterm children. Dr. Lewis, thank you so much for joining us here tonight while we celebrate World Prematurity Day.
It's great to be here. Again, thanks, Fabiana, for the invite.
So I know you have a presentation to share with us, and you can start sharing your screen. And for all of you watching us live on Facebook, on YouTube, please send your questions, your comments, and we are going to address them at the end of his presentation. Let me bring here to the stream. Okay, the floor is yours, Dr.
Thanks, Fabiana. And I think it's a privilege for me to be here talking to you all on this wonderful day of World Prematurity Day. I know it's a great day for anyone related to prematurity, whether it be preterm neonates, children and adults born preterm, and parents, as well as for people like us who work with preterm neonates. So I want to first disclose that I don't have any conflicts of interest, but I also want to confess that I'm not an expert in mental health, but it's one of my interests being a neonatologist and having worked with so many parents of preterm neonates. It's been an interest of mine, and I've been working for the past few years on this field. So we'll discuss about the common mental health conditions that is commonly seen among parents of preterm neonates. we'll just quickly discuss about the risk factors for those mental health conditions, their relevance and consequences. And briefly, I'll touch upon some of the treatment options that we have. So I think for those of you who attended the morning session, like it was quite clear, and we all know that preterm birth has quite a significant impact on the family unit, and it starts right from the time of preterm delivery or sometimes even before that. So quite preterm birth in most scenarios happen in a very sudden and unanticipated fashion, so that parents do not have enough time to mentally prepare for their baby's arrival. So that creates a lot of stress when preterm birth happens. We also heard in today's morning sessions that most of the time these babies are very fragile. They need advanced medical care, so they have to be taken to the NICU for medical support. And this creates a physical and mental separation that a lot of families find very difficult, especially in the first few days of life and even beyond. So that's additional source of stress for families. When a term baby is born, most families are the primary caregivers for their baby. So the baby is with them. They have complete control over what is going on with their baby. Whereas when a preterm baby is born, I think that control, parents lose that sense of control because the baby is taken away, and then it's a medical team that's kind of managing the baby. So they go through that sense of control, which can be very frustrating. And then that altered parental role, where parents don't have that primary control over their baby, creates more problems. And then in addition to that, I think being having a preterm baby, parents have a lot of questions which go through their mind, including, is their baby going to survive? What are the long-term outcomes of their baby? And a lot of times, I don't think even as a medical team caring for your baby, we don't have a clear answer. So that creates a lot of internal distress among parents. And NICU environment adds to all this, even though as a medical team, we want to be as much welcoming and supportive to parents and families. The sounds of monitors and alarms going on, the smell of the NICU can be overwhelming for many families. An ICU course, I don't think I need to say anymore. It can be quite challenging in the sense that there can be so many ups and downs, and many families describe it as a roller coaster ride. And we all know about a lot of complications of prematurity, whether it be related to brain, to lungs, to gut, that can affect this course. So all these factors can affect the mental health of families quite adversely, and then predispose them to have mental health conditions. So in addition to these factors, there are a lot of factors that go in favor for parents. For example, family support and social support that can help families go through this very stressful condition. The medical team is always supportive and tries to help family navigate through this stressful period. A lot of families rely on their faith, religion, spirituality to go through this period, and families use their own coping and resilience mechanisms. So it's always a balance between the factors that predispose one to have the mental health conditions and the other factors which help you to prevent from developing those conditions. And sometimes the balance can tilt in favor of the family or the father or the mother developing a mental health condition. And it's just not a one time event, because I think it continues when the baby continues to stay in the NICU and even beyond NICU once the baby goes home. And some of the factors changes as the baby stays longer in the NICU. So caring for some families, concerns might be not having enough time to spend with other kids in the family, so caring for other children. And some families often have to compromise on their education or employment during this process. Quality of life, some of the parents find it a little difficult because of trying to have enough time for themselves as well as other members of their family trying to care for their preterm child. A lot of studies have shown that there is fathers and mothers of a preterm child perceive stress and deal with it in different ways, and these differences can sometimes create conflict uh, between partners in a marital relationship, and that can create additional stress. In addition to this, we all know that parents of preterm units worry about their child's development and as well as the medical needs of the child. So all these factors going on an ongoing basis can culminate in parents, fathers and mothers having a mental health condition. So the most commonly studied mental health condition includes depression, post-traumatic stress disorder, otherwise called as PTSD, anxiety, and then there's another condition called as stress disorder. So these are mainly the 3 or 4 disorders that have been quite commonly assessed or studied among parents of preterm neonates. And I'm just giving one just quick example of how prevalent mental health conditions. So here I'm talking about postpartum depression, and that's depression that happens after delivery until 1 year after delivery, and it can happen even in parents of term delivery term babies. So you can see that the pink one are the mothers. So around 1 to 2 among 10 term mothers can have postpartum depression. When it comes to fathers, it's around 1 father among 10 fathers, and this we are talking about term deliveries. And as you can imagine, it's much more common, much more prevalent among parents of preterm neonates. So it's among preterm mothers, it's 4 to 6 among 10 preterm mothers, and among fathers, it's 3 to 4 among 10 preterm fathers. So it's at least 3 to 5 times more prevalent among fathers and mothers of preterm neonates than fathers and mothers of term neonates. And it's exactly the same scenario even for anxiety, PTSD, and the stress that we talked about in the earlier slide. So it's definitely very common and very prevalent. And there are some risk factors which, like if we know ahead, we could actually predict if that family unit, if those father and mother might develop depression. So some studies have looked at what are the risk factors. So there are some social risk factors and some medical risk factors. And the social risk factors are factors like social support. So families that do not have social support, families who have immigrated recently to a particular country, those families do not have enough social network, and they are at high risk for developing mental health conditions, as well as families who have lower education as well as lower socioeconomic status. And there are some medical risk factors, which includes prior mental health issues. If a father or a mother has pre-existing mental health condition like depression or anxiety prior to having a preterm baby, that's one of the strongest risk factor for having a mental health condition after having a preterm baby. And then, as we talked about, preterm babies who have a lot of complications related to various organs can have their parents can have are at higher risk for developing mental health condition, as well as factors related to child development. So children who have developmental delays, cerebral palsy, and other developmental challenges, their parents are at higher risk. I don't think I need to tell more about the mental health consequence. I think we all know that mental health has a very pervasive effect on one's life. So it can affect one's physical health. It can compromise your employment as well as your productivity. And a lot of studies have shown that if one partner in a family has a mental health issue, then that can affect the mental health of other partner. And we also know that mental health is very crucial for a child's development, because you normally need a good interaction between the parent and the child for the child to have normal development. And in parents who have mental health conditions, that interaction can be affected, and that can in turn affect the development of the child. So the $1 million question is what can be done about it? And I think there is no magic bullet which can solve all the problems. I think it's a very complex problem, and adding to the complexity is the issue that mental health has a lot of stigma still in our society, and sometimes people, like even medical professionals like us, do not want to talk about it, and so it has a lot of stigma, so it doesn't get as much attention as it should get. But I think the way to approach it is to have a very comprehensive approach, in the sense that you have to tackle or address the issue right from pregnancy or even prior to preterm delivery, and then continue that support throughout the NICU stay, post NICU stay as well. And then we also have to look at, it's not just about treating the mental health condition. I think we need to actually address the factors that lead to the mental health condition. So we might have to address some social factors which would help uh, um, the mental health situation of parents. And in this slide, I've just tried to summarize few quick things I thought about when we think about how to support the mental health of parents. And even as a neonatologist, I am guilty of this. So for example, when I go to see a mother antenatally to talk to her about, to that family about preterm birth and what to expect, I think I should be talking to them about what are the mental health challenges they might face. So I think I've been missing that. And I think the last few consults, I became more aware of it, and I started talking to them about what are they to expect when they have a preterm baby, and what can happen to their mental health and how to go about that. So I think that education is very important to make families aware of what would happen to them, in addition to all the discussion that we have about what will happen to their baby. So I think it's very important what they can go through, what their symptoms might be if they have a mental health condition, and what are the red flags and when to seek help. I think a lot of NICUs across Canada, most NICUs, I think are doing a very good job with family-centered care. But I think we still lack a little bit on screening and support programs. For example, in my NICU, if I feel a mother or a father of a preterm baby is struggling with mental health, I still cannot refer them to a mental health program directly. I have to tell them to go and see their family doctor, get an appointment. And a lot of times, it's not something that's going to be successful, because families are invested in an ICU. They want to be with their baby, and I think it'll be very hard for them to see a doctor for themselves, taking that time out. So I think we need more screening, support, and referral programs in an ICU. And you actually need people who can come into the NICU or who are in an ICU, who can help families tackle their mental health situation. And I think we have a lot of NICUs where we have excellent veteran parent support, and that's an excellent support for these families. And I think we also need some more emphasis on education of the medical personnel, including doctors, nurses, and other support persons in the NICU, who actually can. I know I definitely want to give a shout out to all the nursing and the physician colleagues in this webinar, because I think nurses do an excellent job supporting parents, validating their concerns and offering more support. But sometimes I think having an extra training and education on the mental health aspect of parents would be beneficial to address some of these concerns. And I think post and ICU, I think we definitely, these are families who are coming into healthcare contact at multiple time points, especially when they come for their child's care. And I think those are all opportunities to further screen and provide continued support for these families. And I think, again, we need more regular primary care follow-up for these families, even after preterm delivery. So I think that's the summary of what I wanted to say to you. I wanted to thank Fabiana, especially again for the invite, and Karen and Rebecca for their continued support in some of the research projects I've been working with. And a quick shout out to all parents. We are doing some research looking at the impact of preterm birth on parents, of which mental health is a big component. And I'm looking for volunteers who would like to participate in it. So if you are interested, let me or Fabiana know. And my email is here, as well as my Twitter if you want to message me. Thank you.
Thank you, Dr. Luis. You can stop sharing your screen so you can see yourself. Thank you so much for putting this evening into context and really explain sometimes the root cause, because we see our families down the road, a year, 2 years after the NICU, but we know that trauma started in the NICU or before the NICU. And thank you so much for sharing the information about fathers' mental health, because this is something that is not widely spoken. Very recently, I learned that fathers also experience postpartum depression, which was very new to me, and I'm sure is very new to many people, and how we can recognize and address. So thank you so much for joining us here tonight. It was a pleasure talking to you, and congratulations on your work, because we need more neonatologists and more NICU staff really asking parents how they are doing, giving tools to access support. And I think that is very important to the work that you're doing in Canada. So thank you so much.
Thanks, Fabiana. Again, I think for all your support.
Thank you. And our next talk is with therapist and parent Kate Robson, who is going to explore what happens to our minds and bodies when we are in the NICU with our babies. what we can do to cope, and how we can help ourselves and our children recover and restore once you're home from the hospital. And I have here joining me live from Toronto, Kate Robson. Both of Kate's daughters were born preterm, inspired by her own experiences. She came back to the NICU in 2010 to work with families as a neonatal intensive care unit family support specialist. Since then, she has developed programs for hospitalized families and trained peer counselors across Canada. She went back to school in 2018 to become a therapist and now has a private practice in Toronto where she offers support to NICU parents and clinicians. Kate is also the chair of CPVF's Family Support Committee. Kate, thank you so much for joining us here tonight.
It is so completely my pleasure. And happy World Prematurity Day.
Happy World Prematurity Day. It was a beautiful day today. We had a 3-hour live streaming with clinicians, parents, adults who were born preemie from all over the world. It is indeed a special evening to raise awareness. And I think this conversation has to continue beyond today because mental health, especially during this time with the pandemic, is more important than ever.
I completely agree. And I just want to start even by taking a moment and just taking a breath, and making room for all these feelings, because days like this are really important and they're celebratory. And then also a lot of feelings can come up. And I just kind of want to make a bit of room for my own feelings and for maybe feelings that some of you might be experiencing. And I also want to just sort of start off, as is often the case when I talk about anything related to the NICU. I feel inspired by something a parent said to me. And I kind of want to use this image, this phrase that a parent gave me as a jumping off point tonight. And so I think it's true for many NICU parents. When you're in the unit, taking care of your baby or your babies, you've got other responsibilities too, right? They don't magically go away. So you might have other kids at home, other family members you're tending to, business that you have to do. And so, one mom back in the day, when she was in one place and she was always feeling like she needed to be in another. And it made it really hard for her to ever feel okay about what she was doing. And I felt really awful. And so she would say to herself, where do I need to be right now? And use that as kind of a grounding phrase. And it was just an invitation to put her energy into being where she was and to doing what she needed to do in that moment. And when she said that to me, it felt, like many wise things do. It felt very simple and kind of elegant, and it really resonated with me. It felt like great practical advice for dealing with those situations. When you have a baby in the hospital and a child at home, the sort of gentle reminder to bring your attention to the present moment and to be kind to yourself if those feelings of guilt show up or worry, because they will, right? And so, yes, I think this can be a great grounding thought for parents whose babies are in the NICU right now. And it's practical, geographically, it's a practical kind of thing to think. But I think it also works for us as a grounding phrase, a statement, if we think about it in a slightly different way. And if we think about our emotional and physiological state. So one thing that is very challenging about the NICU, whether you're there right now with your babies, whether if you work in one, or if you've left it behind and you're at home with your kids, but it is the kind of space that keeps you right at the top of your range, your emotional range, your scale, very activated nervous system on high alert, right? You might be functioning really well. You might be doing all the things you need to do, pumping, holding, feeding yourself, showing up for rounds, all of the things. But it also might not take very much. You might not have a lot of space left. And you could be nudged into panic pretty easily, right? Or you could be pushed right off your scale into a state of collapse where you really can't do anything at all. So being in the NICU with the alarms and the smells, all the sensory stuff, all the sensory input for everyone who spends time there. So parents, babies, staff members, it is exhausting. And staying for any amount of time in that activated state, it is exhausting. And I think we need to make space for that and really respect that. And so that's where I think this question, where do I need to be right now, can be really helpful. So, can we notice where are we on our own personal scales? Can we notice if our heart is pounding? Maybe our mouth is dry. Maybe we have tension in our jaws. Maybe our tummies don't feel so good, And can we be gently curious about why that is? And maybe we do need to be here. Maybe it's okay that we're at the top of our scales. If you're walking on the street and a truck comes barreling at you 100 miles an hour, I sincerely hope you let yourself get activated and you get out of the way, right? And there's certainly many moments that are the emotional equivalent to that truck, right, in the NICU. So sometimes, yes, we are at the top of our scales, of our registers, of our ranges, and that's where we need to be. And then sometimes we will feel some of these markers, we will feel the pounding heart, the dry mouth, but we aren't necessarily in that situation of crisis. And in these moments, our minds can do really interesting things, right? They can try and solve the disconnect between what we're feeling and what we're experiencing by interpreting an experience as a crisis when it may not actually be. So an example of that is something that I think is really common for NICU families. I certainly experienced it and continue to experience it myself sometimes. When you come back to the hospital for a follow-up visit, right? And sometimes parents can feel just sick with nerves, convinced that terrible news is going to be coming. I think this is an experience that's commonly shared among NICU families. Find themselves wondering, what's wrong with me? Am I normal? Am I crazy? Am I not well? Or is there meaning in these feelings? Is something terrible going to happen to my baby because I'm feeling this way? Is there something actually wrong? And let's make space for all those feelings. But maybe also we can ask with great self-compassion and kindness and care, and we can ask ourselves, am I where I need to be right now? So is there an emergency? Or maybe am I having a very human, very understandable reaction to being in a familiar place, in a particular place, smelling particular smells, hearing particular sounds? Is that what's going on for me right now? And if that's the case, and if I'm feeling a little more activated than maybe I need to be, or is useful for me to be, what might it take for me personally to come down on my scale a little bit? So I don't have to get right back down to the ground. I don't need to get back to a place of like happiness or, I just need to come down just a little so that I feel like myself again. And I think that is an achievable goal, right? And that's where we can invite in slow breathing techniques, conscious breathing techniques, gentle stretching, comfort behaviors or other techniques like positive distractions, positive sensory input. So using nice smells. I have my props here, the little perfume samples that I have around. Just if I need something, to take the edge off, taste of something very nice, But these are all really useful strategies, useful techniques to just, again, turn the volume dial down a little bit on our activation, to give our feelings somewhere to go. There can be so many things. There can be grounding phrases, these phrases that we say to ourselves. So things like, where do I need to be right now? Something that I often ask myself is, what is this in service of? So I can try and make a connection between something I'm doing and some feeling that I'm having. We could do visualizations. Those can be really helpful. Listen to music. Any sort of positive sensory input can be really helpful. And I think that's to know that there's something we can do when we're feeling kind of stuck up there at the top of our scale. I think that can be very empowering, to know that we do have, again, we can't make the feelings go away, but we can do something to lessen the intensity and to give ourselves room to move. And there's something else I want to touch on that's related to this. And I just want to acknowledge that, because I'm talking about something that can bring up some big, big feelings for NICU parents. And because I want to touch on the potential impact of prematurity on our kids and what it does to their nervous systems, right? And that can be a really painful thing to step towards. So if you're listening, and if this feels kind of tender or uncomfortable, that's okay. And if you need to take a moment, take a moment. But I also want to be clear that I'm speaking from a framework of thinking preemies are amazing and fabulous. And they are amazing humans who lead amazing lives. And so what I'm talking about, it doesn't erase how fabulous these kids, our kids, are. Just to be clear. I'm pretty biased in favor of preemies, I have to say. But something that I've noticed about many preemies is that not all, but many, sometimes kind of hang out at the top edge of their nervous systems, the top edge of the scale, right? So they can do great things. They can be really functional. They can be quite happy in this zone. But that zone might be kind of narrow for them. And it might not take all that much to push them over the top edge into panic or anxiety. And if we take a moment to think about, and this is the painful part, if we take a moment to think about all the sensory input they received when they were quite small, it makes sense that they might have that slightly thinner zone of tolerance. So what does that mean for us as parents? It might mean that some of the things we are seeing and some of the things that they do, we might interpret that as behavior, or we might interpret that as a choice that they're making to do certain things, right? And I'd like to sort of suggest that these aren't necessarily choices that our kids are making. And so why this is important is if we see it as a choice, then what we might start to do is try to talk our kids out of it, try to talk our kids or debate with them or reason with them or argue with them to try and get them out of an activated state. Or we might set up sort of disciplinary structures like reward charts or timeout steps or things like that to convince them not to do certain things. And I've certainly tried a heck of a lot of things like that as a parent. And I think what I want to suggest is let's look through a different lens and let's see that our kids might have that slightly narrower zone of tolerance. And so when they act out in a particular way, when they're up at that upper range, it's not necessarily because they chose to be there, but something's pushed them up there, right? And then what we might realize is that they need our help. They need us to meet them there to help them regulate and come down. So if you think about them as like maybe they're a little bit lost in a mountain, right? And they need us to be like the Saint Bernard, right? Except maybe in our barrels we don't have rum, but we have like goldfish crackers or something, right? So they need us to meet them where they are emotionally and help them come back down, right? We don't need to understand in the moment why they're there. We just need to acknowledge that they are there, right? And then we can use the same techniques that we use for ourselves, the positive sensory input, the breathing, state identification, feeling identification, all of that to help them come down the mountain, right? And so with time and modeling and repetition and practice in calm moments, I think our kids, what they learn to do is tolerate more and more. And they'll still have all the feelings, but what they do when they have the feelings, that's where you'll see the change. So everything that I've said about supporting our kids with feelings, about recognizing our own states, working with our own nervous system, all of this is predicated upon a stance of having deep respect for our feelings, right? And this might feel uncomfortable or unfamiliar to some of us. I think a lot of us have been brought up and often by deeply loving parents who really were doing their best for us. But we were taught to disregard our own feelings, right? So you might be thinking about why are you so upset? Things like that. And these are things that get said all the time. I've probably said these things myself. And you may well, this might remind you of times in the NICU when you were feeling sad and somebody might have said, with the best intentions in the world, be grateful, don't be sad. Oh, why are you sad that you didn't have a baby shower? Everything's fine. Look at your baby, And yes, those statements come from a very positive place and from the best intentions, from people who care for us and don't want us to be suffering. But the thing is that people can tell us not to feel those things. We can be telling ourselves not to feel those things, but we still do, right? And when we get caught in that kind of loop, what can end up happening is we start having thoughts and feelings about our feelings. And that's where a lot of suffering can come in, right? So I think the most important thing I want to say tonight, and then I want to conclude with, is that whatever you're feeling, It doesn't need to be exiled. It does not need to be banished. There is room at the World Prematurity Day party table for guilt and shame and joy and hope and irritation and worry and resentment and fun. It all gets to be there. And if you need to talk to somebody about how you're feeling, you don't have anyone close to you who you really trust with these feelings, CPBF, we have a group every week, Tuesday, 12 o'clock, people who will understand. There's a wonderful counseling program that if you are in the NICU or recently discharged, 4 free sessions available to you. So I really urge you, if you are feeling alone, and if you're feeling like it's really hard to hold all of these thoughts and feelings that you're experiencing, please don't feel you have to do it alone, because there are people there who care very much and who I think will understand.
Yeah. Absolutely, Kate. Thank you so much for sharing your knowledge and experience with us tonight. Great tips. I think I can use a lot of them tonight. So, absolutely, yes. It's been a great day, but obviously talking about NICU and hear family stories put sometimes myself back into my own trauma, my own experience. And yes, sometimes you have to take a break, take a breath, and acknowledge the feelings. That's so important. Kate, but let's talk about the program that we offer, because when you were the executive director of CPBF, you had this on your strategic goal to offer free therapy sessions for families. And we didn't have the capacity to do it. So last year when COVID started and we realized that all the programs in the hospitals were suspended for obvious reasons, we really step up. You step up to create the COVID care program immediately. We put together the program in 4 weeks, and we have served about 100 families to this day. So I wanted to talk about your lessons learned from this program, how we have served the families, and how important it is to offer this therapy for families in Canada.
Well, thank you, Fabiana. And also thank you for your leadership in making this happen. And, just take a moment, do that. I think, oh my goodness, you always learn so much when you talk to NICU families, and everybody I've had the privilege to meet and talk with, I've learned something new from them. I learned that people have immense capacity, so much love, so much care there. I've learned that when in the NICU, there's sort of, there's different types of work that can be done at different times, right? That's why I love the fact that the program, it's not just about parents in the NICU, but it's also for after, right? Because I think what happens when you're in the NICU, it can be kind of a back to basics approach, like looking at sleep, nutrition, connection, movement. Let's not get fancy. Let's just make sure we've got the foundational pieces, right? And then you get home and you kind of settle into your life again. And that's when a lot of the big stuff can show up. And that's when a lot of kind of older stuff can show up, feelings about your own family, feelings about, the difference between what you'd expected and what you got. And it can be really hard. A lot of parents talk about the first birthday being a really, really difficult time, when you're coming back through some of those same seasons, but with a very different knowledge, right? So, so I think that there's different things that are needed at different times. I feel grateful that we can expand the program to reach people in these different moments. And I really want to encourage, parents, reach out, because it's lovely. Like you set it up so it's self-referral. You don't have to jump through stupid hoops to get access. I love that. I think that's so important. And I also want to encourage, if there are NICU staff members watching or listening, let parents know about this. Right? Because we don't want to be the best kept secret. We want people to know that there's help for them. It's really, really important. Yeah.
Absolutely. I'm going to share a little video here, because we are bringing a new clinician into our team in January 2022.
Hi, Fabiana and everyone. Anna Maria here. I am so grateful to have been put in contact with Fabiana and to be a new member of the Canadian Premature Babies Foundation in the new year. My baby was born at 29 weeks, 2 pounds, 2 ounces. This was back in 2014. It was the most eye-opening, traumatic, and beautiful experiences of my life. And to now be able to work with preemie families is just a blessing and a dream, to be honest. I found myself postpartum knee deep in anxiety, so postpartum anxiety. And I am, in fact, a clinical psychologist specializing in anxiety and anxiety treatment. So let me tell you, boy, did I learn a lot. It just enhanced who I am personally and professionally. And in many ways, it was traumatic, but in many ways, it was a life lesson and an education. I look forward to helping other people, other families that are in a similar situation than I was. So thank you so much. And I look forward to working with you all. Bye.
Wow, what I love about Anna Maria's story is the acknowledgement as a healthcare professional, a psychologist, really acknowledging her own feelings and her own anxiety after the delivery of her preterm baby. And I think this is such an important lesson for all of us, that it's okay to talk about our feelings, our emotions, and we can all be vulnerable at one time in our lives and really say, I need help. Absolutely.
And one more thought, because I know you have a lot more to talk about tonight, but sometimes it's hard. We may have been very trained to not take care of our own needs, right? It might be really hard to push against that and ask for help. And so I kind of want to push on our buttons a little bit and say, it's not just about us, it's also about our kids, right? And so if we reach out, if we normalize it, talking about our feelings, talking about our mental health, asking for help, we're teaching them that it's okay too, right? So if you can't figure out a way of doing it for yourself, maybe you can kind of work with your operating system a bit and know that if you do it for yourself, you are actually benefiting your children as well.
Absolutely. So important. So Kate, for families to access the program, what do they need to do?
It's super simple. There's an application form online at the website, and you have it right there, which is, of course you do. And it really, we designed it so that it would be very, very easy, like no barriers to entry. You just apply. And if you're part of our support group, every week, every Tuesday, 12 Eastern, we have a support group as well online. Really lovely people. And I just really encourage people to join. It's really nice to connect.
Wonderful. Kate, thank you so much for joining us here today. Thank you for sharing your experience, your knowledge with us. And I'm looking forward to working with you for many more years.
Me too. Me too.
So it is very important for CPBF to continue to offer free therapy for families. Studies have shown that programs aimed to provide support for parents and families can significantly improve long-term benefits for the entire family, along with the quality of parent-child interactions and children's outcomes. And today on World Prematurity Day, we have an amazing and excitement announcement. Give me 1 second here. There you go. Our COVID care program has a new face, a new name, and a new criteria, which will include more families. And thanks to Pampers Canada, CPBF will be able to offer 4 free therapy sessions to 100 parents through our parent care program in 2022. And today, Pampers launched this beautiful campaign that I'm going to share the video with you, and you can see on their social media as well.
I have a son named Jack. He's born at 27 weeks gestation.
She came out crying and breathing at 1 pound, 3 ounces at 24 weeks.
It's very hard to be in the NICU alone.
It was up and down, emotions all over the place.
A lot of blame and guilt. You had one job to do, which was to carry a baby to 9 months.
There was a lot of mental health issues there.
Because of COVID, a lot of the supports were taken away.
That was very traumatizing.
First time I felt like a parent was when I put my hand inside the incubator and I held his hand.
Changing their diapers was a special moment between parent and child. Pampers, they see us. They see us in the hospital and they want to help.
The mental health supports that were available through the Canadian Premature Babies Foundation, that was a really great support that I was able to also access.
You need to be strong for your child, but you also need to take care of yourself.
Please do join the campaign by using the hashtag I'm going to share here, Pampers for Preemies. on your social media channels, please do make your posts public so we can count the hashtag. And every time you use the hashtag Pampers for Preemies or purchase Pampers Swaddlers at Walmart Canada from November 17th, from today until December 17th, Pampers will donate 40 cents to the Canadian Premature Babies Foundation Parent Care Program. We are so grateful to have Pampers partner with us for the year 2022, because more than ever, families need mental health support to cope with the NICU, but also with the restrictions the NICU have imposed on parents during the pandemic. And I have here joining us live from Hamilton, Ontario, this amazing couple who I had the pleasure to meet when we were shooting the Pampers video, Janita and Jimmy. They are from Hamilton, Ontario, as I mentioned, and they are here to share their NICU journey and how they coped with it. Their son Jack was born at 27 weeks gestation in February 2020, right before the pandemic. They spent 104 days in the NICU. Jim and Janita, thank you so much for joining us here tonight on this World Prematurity Day. It is the first year you are joining the celebrations of World Prematurity Day, and you have this incredible story to share with us. I know you prepare a presentation, we can share your slides, and you have a question and answer period at the end.
Thanks, Fabiana. And thank you, Kate and Dr. Lewis, for all the support you guys are giving us. As well, Fabiana, as well to you and Pampers. That's the first time we heard about what's happening in 2022, and that's great to hear. The mental support is a big issue here with us, and we're glad other parents can have it. So we're just going to talk about our journey through the NICU. We had the unique journey of being there before COVID and during COVID. So we got to see both worlds of what happens in the NICU, and we feel like we have a great perspective of what parents during COVID have missed out on, what the normal things that are provided by the NICUs.
So just a little bit of background on how we ended up there. So on February 25th of 2020, I just drove myself after work to labor and delivery because I was feeling decreased fetal movement. And I thought everything would be okay. After about being monitored for an hour and a half, 2 hours, the doctor realized that Jack's heart rate had dipped. So a few hours later, an ultrasound was done, and that revealed that there was placental insufficiency and Jack had stopped growing. So we had a plan of trying to keep him in me for as long as we could, up to maybe like a week. But moments after that conversation, his heart rate dipped again, and an emergency C-section was performed. And 11:33, just hours after I had arrived, Jack was born weighing 1 pound, 13 ounces.
So yeah, we're going to talk about first just the pre-lockdown or the normal NICU visiting protocols. It was a shock to us that we had Jack born that day. It was around midnight. I called my parents and Janita's parents. Hey, we're having a baby now. And they all showed up in support. My brother-in-law showed up from the university from about an hour and a half away, and he's a young guy. So it was great to see that, and everyone was there. And then everyone was allowed to see Jack for the first time. I had to take him one by one as Janita was out of surgery. So made about 20, 30 walks, bring each parent or each grandparent or cousin over there to see Jack. And planning out support was thinking like, okay, we're going to be here for a long time. How are we going to do this? And I was saying, well, I'm going to be back at work one day. Janita, you're going to be going. You can take a family member, maybe my mom, maybe your mom, once in a while, my sister, to go help and support us because we have a great support system. And then I can go after work in the evenings on my way home and spend time with Jack. And so that's what we thought was our original plan. And on top of that, like the NICU services we saw, they had parent nights, dad nights, pizza nights. There was the social worker was there. There was parent advocates in our hospital, some that have been on this website. And so there was a lot of support going on at the time, and it seemed all great at that time pre-lockdown. And then, yeah, like we were both allowed to be by Jack's bedside. We'd receive tough news together. We'd be able to make decisions together. There were some trials that were happening that our hospital asked us to be a part of, in which we were, so we could take those decisions together at those moments. Doing things like changing his first diaper, holding his hand, giving him his bath, those things we were able to do together. And I don't think we thought about that. I think that was a norm, thinking, you know, we're going to do all these things together for the first time. Lo and behold, that was going to change soon.
So you can see here, we have pictures of our first cuddles with Jack that we were both able to take of each other. And the little video in the middle is when Jack had his first infection. And that was one of the toughest moments for us. And we really spiraled, but we were able to be with him together, which was really important for us, because being separated and dealing with that news that he has an infection would be even more traumatizing, on top of the unexpected birth and dealing with everything in the NICU.
And so the lockdown rules had changed. We went from no visitors, so it was just Janita and myself. And I said, okay, that's fine. We can handle that. No problem. And then they said, well, now we're allowed one parent in 24-hour periods. So I could go Mondays, she could go Tuesdays, and we alternated days. We spent most of our day there. We were fortunate that Jack was our first baby, so we didn't have a lot of other things, other kids at home. So we spent quite a bit of time, 8 to 10 hours there, to spend with Jack. Even at times I would go at 10, 11 o'clock at night because I was sitting at home watching TV or being on my phone. And I thought, hey, I still have a couple hours left in my day. I'm going to go hang out with Jack. Some of the other things that we realized that were like, after a couple of months, was, hey, we're never together. We've never shared any moments together in a while. My birthday fell during that period, as you can see in the picture. So I had to celebrate. It actually wasn't my day. So I kind of snuck in. I went in there at 11:59 with a cupcake because I wanted to spend my birthday on him. And then I spent 30 minutes in there and I had left. And the rest of the day, the next day was Janita's. And I didn't want to take away that day, because then it would have been almost 48 hours for one of the parents not to be there. And that's very hard to do. Some of the things like news, vaccines, the pharmacist would come in with the vaccine news and say, okay, we would like to give him this. And you kind of have to make the decision right there. And so I'm trying to get a hold of Janita, and usually she was easy to get a hold of and saying, and I'm relaying information. Whereas if we were both there, we would get the information firsthand. So I'm passing on medical information that I have no experience on, trying to give her that news to make that informed decision. And so things like that were definitely hard during the time of COVID. A couple of other things that were hard were, there was no waiting rooms anymore. The cafeterias and stuff were not there. Not a lot of places to go. The way we had it was technology, FaceTime, Zoom, WhatsApp video calls. We did a lot of them. At the start, Wi-Fi wasn't free at the hospital, but they had changed the rules and they made Wi-Fi free, which was really helpful. As our phone bills were getting quite high, just doing a video call. I think we spent, I'd say, 2 to 3 hours in doing video calls with Jack. Everyone wanted to see him. So that was we were very fortunate enough for this technology to help us here. On top of that, I'm trying to think of things in the NICU that they told us were emotional roller coaster. They use that term, and that term's always stuck with me. Ups and downs, and they say 1 step forward, 2 steps back. We would get news. We'd get all the monitors, so the heart rate is breathing, and you would feel like you're making progress. And then, hey, we're getting close. You're getting somewhere. And then the next day he's back to square one, and we're like, it just deflates you. So those things are very hard to do. On top of that, changes, when they say at the start, changes will be fast. In the NICU, babies are always coming in. There's always a new baby being born and a new baby coming in. So they have to make the best they can with it, the space that they have. And so you might show up one day and you go to your pod and they're like, your baby is not at that pod. Your baby is in a different section. Things like that. on top of moving hospitals, we had to move hospitals, as you can see there with Jack. He got put in a little oven. We got I'd say an hour and 15 minutes notice of him leaving. And so that was a little bit stressful there. You just think, oh, you feel comfortable in this hospital with this staff and everything, and you're just going to move to a new hospital, and there's such unknowns there. And again, you're not together, so you're kind of like, okay. And then you just I call Janita and say, hey, we're moving to a different hospital today. And she's just as in shock. And I could sense her being at home, and she can speak to this. Getting all this news is kind of hard as well.
So my experience during lockdown and restrictions, I felt that the days were very long and lonely because only one of us was allowed. It made no sense for me to go back home during the day and try to break it up. So I would be there, like Jim said, for very long hours, 8 to 10 hours a day. And within those 8 to 10 hours, there was a lot to do. Kate had mentioned earlier, you're trying to make rounds, trying to get in touch with the doctors, you're pumping, you're trying to eat and survive yourself, and you're trying to pass along information. I would try to contact Jim and have him video call Jack and pass along any information that I could get as well, because I know it's his day off, but he still misses him. I felt like I had very little self-care. I was just trying to survive. Even with eating, I would barely eat at the hospital. When the lockdown first happened, there wasn't really anywhere to eat. I think the cafeteria was open, but there wasn't much options. There wasn't an area for us to go and eat. I would take maybe like a 10-minute bathroom break after I finished cuddling Jack, eat like a bagel really quickly somewhere in a hallway, and then go back, and that's all I would have. Then I'd go home around 9 or 10. It was like a schedule of eat, shower, and then pump. And when you're a mom, you're still pumping those every 3 hours. Even though our baby's not with us, we're still getting up in the middle of the night and pumping to make sure our supply is there. So I felt a lot of pressure to pump. And some feel like this took away from my time with Jack. When I would go there, I had to think about, okay, I need to pump. I just pumped before getting here. I'm going to cuddle him. He needs to eat. Then I have to put him down so we can make that transition. He can have his feed, and then I need to pump, and then I'll, do the same thing again. And then, have all those pump kits with you and washing your pumps, and you're doing all of that on your own. And sure, you can get through doing that for a day or two or a week, but doing that for a few months is very exhausting. I became very tired of communicating through text messages. We're so fortunate to have a big family, but everyone wanted updates. So I was trying to send pictures and video call everyone on top of like the pumping, and I'm trying to spend time with Jack and trying to meet with doctors. So I was just tired of talking to Jim all the time. We didn't see each other. We were on opposite schedules. So we really never talked. Even when I'd come home or he'd come home, it was maybe like 1 or 2 minutes, but it wasn't really deep conversations of how we were feeling. And it was definitely a very lonely experience not being able to connect to parents because of COVID. Everyone was on edge. Everyone was so anxious that all parents in NICU were kind of keeping their distance from each other. And like Jim had mentioned earlier, I was really anxious dealing with challenges without having my partner in the NICU. When doctors would tell you news like, okay, Jack's heart rate has been really high. This is what we're thinking of doing. Or his breathing rate has been really high. So we need to move him back up levels on his breathing support. And just taking that news by yourself and having to relay that was really hard versus when you have your partner there beside you, or even another family member or a friend like my mom or my sister. So how did I cope and what things helped me? I was able to connect with other parents actually through the Canadian Preemie Parent Support Network on Facebook. And this really helped me because something that I was looking for from the day Jack was born was, what have other parents' experiences been, and how have what has the outcome been for them and their babies? So I would use this little search tool here, and I would type in things like 27-weeker or 27-weeker in neck and try to find other parents' experiences and learn more information, learn more about, did their baby have surgery with neck, and just what kind of outcomes were there. That any little information I got really helped me. And there were a lot of miracle stories, which really helped me get through those walls sometimes, those really tough days where you have no control and you're just hoping for better news. But, you know, sometimes Jack wasn't making any progress. So there really wasn't anything to do but wait. And during those times, this group really helped me. Support from staff was huge for me. Just notes that nurses would leave. If you can see here, like the nurse is letting us know about Jack's night. You know, he had a good night and he had made his 72 hours. Being able to take home his first preemie sized diaper, which was so tiny, like you can see in the picture, smaller than my hand. Having those little posters up, you know, in his pod with his prints and sayings about how strong they are and how much we love them. That support really helped us, even though I'm sure for nurses, they might not think it's a big deal, but for us, it was something to help us get involved and something to just help get our mental space in a good spot. A few other things, I was able to make one connection with a parent with a parent in person during lockdown, and that was huge for me to be able to share where our babies were in their journeys. And you know, this mom would talk to me about her son going for surgery, and I would tell her about how, you know, Jack made a step forward and the next day made 2 steps back. So, you know, having someone who understood the trauma that you've been through, the worrying that you're always doing, was definitely really helpful. And then one other thing that I did was during lockdown, I set up Jack with an email account, and I would send him emails with his updates and how I was feeling. And this might not work for everyone, but for me, it was something that helped me get out some of my thoughts and feelings. And also it's nice to look back at that someday in the future. So Jack's journey.
And so, yeah, our emotional roller coaster, just to give you a quick update, we had, Jack had quite a bit of trouble breathing. He was on a CPAP for quite a bit of time. He was, that was his biggest issue of getting him home. He was born with a mild brain bleed, but that closed really quickly. He had 2 infections. One was after birth, which we learned about neck because they told us if it is neck, this is a serious issue. We need to rule it out. And then unfortunately, 3 weeks later, he actually developed neck. So that was a tough time for us. We were basically told he's going to have medicine, and we don't know which way the pendulum is going to swing. If it goes left, there might be a bad chance of something bad happening. But if he reacts to the medicine, then he will be okay. And luckily, he went right, and we are where we are today. So the breathing support was just the hard part. It took him a long time to get off of it. We would watch the monitors and just sit the numbers. I'm like, okay, he's trying to get 140 now. That's better. 130, but then it would be back to 150, and that would be really hard to do.
So some of the challenges we faced with the transition home, I had spent time in the bunk room for almost a week, and that was really hard again to do alone because, you know, I was breastfeeding, and as great as the first few times had gone, Jack was still a preemie, and it was exhausting for him to breastfeed. He just didn't have the endurance. So that was really disappointing to deal with without having my husband there. I wasn't really able to have breaks. My husband, Jim, couldn't visit because one parent allowed at the bedside. So while I was breastfeeding almost every feed except for the 3 a.m. feed, the nurses would do that one. I would have to then give him the bottle because he would never get enough. And then I wouldn't leave until he was settled. And then I'd have to go back and pump and then wash that equipment. And like I was saying, you know, one day of that is fine in one night, but doing that over and over again, it really starts to get to you. And just even dealing with the letdown of feeling like I couldn't breastfeed by myself. And of course, I was able to call Jim and talk to him. I wanted to give up, and, you know, he did encourage me not to, but it is just harder when your partner's not there and you're just all by yourself. The discharge date is always unpredictable. So my first picture, May 20th, you know, Jack finally got off his breathing support, and, you know, we had cautious optimism. 3 days later, still off the breathing support, doing great. The 5th day, May 25th, I go in and he's back on, which was like a punch to the stomach. It's just totally crushing because I was like, oh no, who knows how long he's going to be on breathing support now. We still have to get on the hurdle of feeding. And then June 6th, he was supposed to come home. Didn't come home that day, didn't gain weight. And then June 7th, he was able to come home. So quite a roller coaster there.
And yeah, I put this slide up here for me as a dad. I met another dad there. One of the things I did during COVID, we couldn't have family support there, but I feel that, and this is important, I feel for other parents, is we're all there together. It's a community. We all have babies there together, going through needs, and it's almost like a classroom, and we can have shared experiences. We might not be going through the exact same things at those times. So I try to say hello to every parent, see how they're doing, break the ice. This parent that I have a picture of here, we would sit with our shirts off, skin to skin across from each other, and just have chats and laughed at what is happening here. But the support with other parents really helped during this time. So I know everyone's going through a tough time and you want to give everyone's privacy, but it's also good to reach out and take the first step and say hello, because I think when we break barriers, everyone's there for each other. COVID and lockdown, I think that's shown that humanity is social and we need each other. Being alone is not the way to go. And so that's one of the tips I would recommend for other parents to do along this journey of being in the NICU. And so that ends our slideshow. We went a little bit long. We had a long story.
So thank you. It is such an important story to be told. And I love all the points that you guys touched on, the restrictions. And then I see the peer support, the importance of having family, free Wi-Fi in the hospital. There's so many takeaway home messages there. And I'm so grateful, Janita and Jimmy, for joining us here today and for really participating on the Pampers video. It is such a beautiful video of your family and Jack. So thank you so much. And I hope I see you guys soon again. Thank you.
Yeah, this is our first time. We're happy to do this, and this definitely won't be our last time. We're here to help. We all learn from each other's experiences. We have one life to live, right? But so we can't all live one experience of our own. So we need to share and live and understand from others' experiences. And so we're definitely there to help. Anyone ever has any questions, especially from a dad's side, I will answer any questions for anybody.
So important. Jamie, have a look on the chat on the Facebook and YouTube. There's a lot of messages there for you guys. And Casey, thanks both of you. So many great ideas here about support and connection, and so many. Thank you for sharing your stories. So please do go and check all the love messages that you guys received. So thank you so much.
We will. Thank you for having us.
Thank you for all of your support.
And last but not least, I have here join me live from Toronto, Aruna Budram, the autonomous parent of Surya, a micro preemie who spent 90 days in a level 3 and level 2 ICUs. She was discharged at the beginning of the pandemic in March 2020. Aruna will share the reflection on their journey with preterm birth during the pandemic. Aruna, thank you so much for joining us here today. We went a little bit over, but those stories, as you said, are so important to be shared. And I'm so grateful that you're here with us today.
Thanks for having me back, Fabiana, and thank you for all your work. It's been so amazing to see the response and excitement and all the different pictures of babies and kids for World Prematurity Day. And thank you to Kate, who was a personal support of mine when I was in the NICU at Sunnybrook. If it wasn't for Kate, I wouldn't have got through a lot of things that happened. So it's really great to see them again sharing. And Janita and Jimmy and Dr. Lewis, thank you so much. Janita and Jimmy, I wanted to also just say, I can't even, I was in the NICU a little bit at the start of the pandemic, but luckily we were able to be discharged before the pandemic really started happening. And I can't even imagine not being able to have visits and have people come and check in on you and things like that. So sending you and all the parents out there lots of love who are experiencing that right now and have been for the last almost 2 years. So this is I'm not going to go into all the details because we are over time, and Janita and Jimmy did a really great job of actually outlining a lot of the emotional pieces around what comes up for folks and parents in the NICU. I'll just tell you a bit about my story and about my daughter Surya. So I'm an autonomous parent, meaning that I'm a solo parent. So a lot of what Janita was saying about being alone in the NICU is oftentimes a very common experience for folks who are choosing to be single or choosing to have a baby on their own. So I chose to have this baby on my own. I was 19 weeks pregnant, and I got pregnant through IVF with an anonymous sperm donor from the States. I identify as a queer person, gender expansive. So I'm not getting pregnant in a regular heterosexual way. And so I didn't have access to sperm in the same way. So I got sperm from a bank in the States. And so I got pregnant. I had perinatal anxiety, actually. So I was very anxious throughout the first part of my pregnancy. And I was kind of like, in the back of my mind, I was thinking something was going to happen. And then at 19 weeks, the thing that I was very scared about happened. I went for my 20-week ultrasound. Excuse me. And I went for my 20-week ultrasound and at 19 weeks, and it was revealed that my cervix was about less than 1 centimeter left, and it was starting to open. And so I was rushed to Sunnybrook from the ultrasound place. Thankfully, there was these amazing midwives from Seventh Generation Midwife Collective that's out of the Toronto Birth Center, who I was being seen by, and there was a hospitalist midwife there who was there and held my hand throughout most of my time at the NICU. So if you're in the NICU right now, or if you haven't received support from midwives, that is something to consider as well as doulas are really important to support people. And so at 19 weeks, I got admitted, and then I was told that I had a quote unquote incompetent cervix, which, that language is not the best, but they were able to stitch up my cervix. And then I was able to keep Surya growing up until 22 weeks and a half, about 22 weeks and a half, almost 23 weeks. And then I was back in the hospital because my cervix started opening again. So I was living in the high risk unit at Sunnybrook for another 10 days. And it was, everything that everyone could ever imagine. It was the worst, the most traumatic thing I've ever experienced. Every day was complete anxiety and terror about using the bathroom, sneezing, standing up, going to the shower, anything regular that I did with my day. I was absolutely scared, and so scared about what would happen. And those were these are some pictures of me before Surya was born. She was born at 24 weeks and 4 days, and she was 1 pound, 3 ounces. This is her on her second day. I think we took these pictures. And so I gave birth alongside my mom was there. My sisters were there. Some of my best friends were there when I gave birth. It was chaotic. It was ridiculous. It was all over the place. Nobody knew what was happening. She came out with 1 push breech, feet first, with my my cervix still stitched up. But she really wanted to be here, and she came out somehow managing to be breathing. So she was breathing on her own, and was able to actually be put on my belly for 30 seconds for delayed cord clamping, which is very unheard of for 24 weekers. So and then started the journey of the NICU. So my first experience of the NICU was pretty intense. My sister and my sister slept over that night in the high risk unit where I gave birth with me overnight after everyone else left. And we went downstairs and we walked into Surya being intubated. She was not intubated immediately after birth. She was actually on a CPAP. So she was doing pretty well with breathing somehow at 24 weeks. And then was intubated. And so the pictures you're seeing here are actually the first time I ever got to hold her, which was when she was 6 days old. So another big piece of it was that it was you imagine so much of what, you're going to have is within a pregnancy, within a birth. But this was my reality, which was that I was having to figure out how to reimagine what it would be like to be a parent, and also to be a parent in this way that I did not anticipate. So I ended up sleeping and staying over at Sunnybrook for the entire time that she was in the hospital. I didn't leave. I think I left 3 days because I got a cold, but other than that, I was sleeping on the bench in her room, in her pod room, for the 90 days that I was there. And this was the first time I ever held her, which was 6 days old. She was 6 days old. As you can see, she's really, really tiny. It was very scary holding her for the first time. And it was scary, but it was also one of the best experiences I've ever had. And it's funny now looking at these pictures, because she actually still, she's very long now. But she was very much a person who, like, she literally still does that. And she puts her legs up like that. So yeah, and thinking back to that time for me is really interesting to think about how you are very much in just like a go, go, go mode. And, you see monitors in these pictures behind Surya, but I can't even describe to you the ways in which these machines actually are, yes, life-giving and life-providing, but also for NICU parents, very, very scary in a lot of ways, because what it does is it actually brings up so much triggers. I was actually just at Sick Kids last week with my daughter, with Surya. She had pneumonia, and it's so triggering. It is a very triggering process to be listening to these and beeps and constantly going off. Watching those dips happen, looking at numbers constantly, it is a very traumatizing experience. So this was Surya at 3 different major points in her development. So 26 weeks, 28 weeks, and 30 weeks. She was still very small. She had lost a lot of weight after birth, which is regular for anyone that's born. She was born at 610 grams, and then she lost a little bit and went to 558, I think, and then went back up and kept gaining. But you'll see here that there's different pieces of development here, and it was scary every part of the way. Kind of what Janita and Jimmy were talking about. It's a literal roller coaster. And the first thing that a nurse told me was like, you just have to take it, not only day by day, hour by hour, minute by minute. And I really didn't understand the extent at what she meant when she said that, until I was in it. Because one day she would be fine, and the next day, all of a sudden, she needed to be bagged because she had something stuck in her throat and she couldn't breathe anymore. It was just constant. She was on caffeine to keep her apnea to keep her from stopping to breathe. She was on all the medications that regular preemies have. A huge part of it for me at this point was also to be around and to stick around. And it was very important for my mental health. And because I felt so helpless as a person who couldn't keep the pregnancy, and there's so much stuff around not being able to keep the pregnancy, it was so important for me to be there. And this is a picture of me and my sisters. My sisters were some of my main supports, along with my mom and some of my best friends, and the midwives and the nurses, and some of my close community friends who would drop off food, would come and check in on me. And luckily, when we were at Sunnybrook, it actually was pre-COVID, even though the first case of COVID was at Sunnybrook back in January, before everything got really serious. We were still able to have folks there, which was great. So Surya was able to have a lot of people around, people reading to her, talking to her, which is so important. Another big piece that I think and specifically in this situation, as you see in these pictures, I did lots and lots of kangaroo care with her and lots of skin to skin. This is her a little bit bigger. So this is that she got a little bit bigger in the NICU. She eventually came off all oxygen support at 34 weeks. 34 and a half weeks. She was off all oxygen support. And she was breathing on her own. And then we were able to get transferred to a level 2 hospital, which is in these pictures that you're seeing here, where she was then just working on feeding. We were discharged at 37 weeks, and which was 37 and a half, I think about 37, 38 weeks. And she was super tiny. And I can't describe to you, and I think all NICU parents and all parents who experience, birth trauma and loss and all the things that come with the very chaotic ways that little people come into our lives, can share with, is that like, it is a very tumultuous experience. You are literally going, and there isn't very much opportunity to watch the dust settle, because it's always being raised. You're always having to deal with something new. And in terms of support stuff, which was really interesting, I think it's important to speak as a solo parent. There are lots of folks who are solo parents, who didn't have very much support of a partner. And that's a big piece that I think, within a lot of what people experienced during COVID is kind of what I also experienced anyways, because I didn't have a partner. So I didn't have someone who was helping me or just be able to like switch off with me. It was very much me and only me all the time. That's where the nurses really came in and the midwives really came in. And while people did come and support me and did drop by and drop things off, it was also really important for me to be able to maintain a connection with the doctors and the nurses and the staff, because that's actually where I was able to feel like I was able to do something. There's so much helplessness that comes up when you're going through something like this. And the helplessness is really, really hard, considering, all you want to do is like do your best as a parent. And you already feel like a failure. And so, yeah, so now Surya is 19 and a half months adjusted. She will be 2 years actual at the end of December. She started walking at 10 and a half months adjusted. She eats so much. She loves eating. She talks a lot. She loves meeting new people. And she's absolutely the literal most strongest, funnest person I know. I feel like most people with preemies can say this, that they just really want to live. They're just interested in being here, in thriving, in experiencing life. And they will do whatever they need to do that. And it is such a privilege to be her parent. I think that there's a lot of things that we can learn from the ways in which, in particular, kangaroo care and zero separation are important. So zero separation in NICUs, that is 100% why Surya is thriving and why it was so important for me to be there and be with her. And especially for parents, who have 2 or multiple parents, or if they're solo parents who have a big care team of people, or people who are trying to be supportive, like grandparents or friends or platonic co-parents, things like that. It's so important to consider and just to also understand how there's nothing more important than to be there with your kid. And I know a lot of situations that make that really impossible or really hard for parents who have multiple children at home, or who have housing issues, or who are going through multiple barriers because of income, because of the other levels of ways that, the city is really hard to or cities in general, or places are really hard to navigate. But that is why it is important to think about how zero separation is a really key component of not only the thriving of a micro preemies or preemies, but also the mental health for the parents. The more connection that you're able to have with your child and with this kid that you're supporting and literally watching growing up in an incubator, it allows for you to be able to have a connection. Surya and I are so tight. We are so connected on so many levels that I know a lot of term parents don't have that same connection because of what we went through together. And it is a testament to why zero separation and also kangaroo care and also support for families is so important. And I really do think that that's a big piece of why Surya is thriving the way that she is right now. And also how I dealt with my own mental health issues and mental health stuff, was being able to be there, to be able to be there for rounds, being able to ask questions, being able to advocate, having a good support team from the nurses and from people like Kate, and the other peer support people that were at Sunnybrook. Having a big community for me as a solo parent was really important. Having a great family who really supported me. Those are all privileges that I had that a lot of folks don't have, that I'm sure would love to be in the NICU, but we have to think about a larger, grander idea and scale of why and how we've been able to do this, and how we can actually support more families in staying together. The parents who, or the single mom who doesn't have income because she can't get on EI for whatever reason, but needs to feed her other kids at home. How are we supporting them and being in the NICU to support their baby? Right. So we have to think about it in a larger scale of it, around the different barriers to health and barriers to that parents have and families have in order to support these little guys. This is us now. I don't know if she wants to come on the camera now, but this is us now. This is Surya. She is funny and hilarious and moody and going into her terrible 2 toddler years, and is really great at expressing her emotions, at sharing with us what's coming up for her and how she's feeling. We have a literal great time together. I don't know if she wants to come on, but do you want to say hi? Hi. Yeah, you want to wave? This is Surya Amaris, who is now, and that's you. That's you. And we send so much love to all preemie babies, families, parents, community members. We say hi and we love you. And you got this. If you're in the NICU or you just came out, it's going to be okay. And we're going to figure it out, and reach out if you need support. We got you.
Aruna, and thank you so much for joining us here today, for sharing your story. I always learn so much from you, and I've been just in this role for 9 years now, but there's always more to learn, and how can we support families better. And you've been such an incredible supporter of CPBF. You join our family advisory committee. I know, so you also have a lot to say, and you also want to join our committee because your mom is doing incredible work with us and for the community. So Arun, I'm so grateful. And I also love the way you talk about mental health very openly, about the struggles that comes after the ICU. And I know you seek support from CPBF. I just wanted to share a little bit about how was that experience for you?
So I was able to access the COVID care sessions with a psychotherapist. I do believe that therapy is really important for all folks and for all people who are experiencing any kinds of traumas, but in particular, the PTSD that comes up for parents and families that have experienced the NICU is a very special kind of trauma. And I've talked to lots of NICU parents about, yes, all parents are like, oh, wow, I'm always terrified that my kid's going to stop breathing. Imagine you watching your kid multiple times stop breathing, right? That is a very real thing that we have had to actually witness many times in the trajectory of these kids' lives. It's not just a scary thought, right? So taking those things very seriously. And then also it was really important for me to access those services because, and I'm really grateful that they were available to us as parents. So thank you to the Canadian, to CPBF for that.
Yes, Aruna. So thank you so much for joining us here tonight, for sharing your story, for bringing Surya to the live streaming, because after all, this is why we do what we do. And I can absolutely say with certainty on behalf of all the doctors and nurses and the researchers, this is the reason we do what we do. They do what they do to see babies thriving. And I'm absolutely delighted to see Surya, to see her on the Pampers video. It was so great to spend the day with her when you're shooting the video. And I really want to thank you for being here today and for being open to share your story with us tonight.
Thank you so much for having us. Say thank you. Thank you.
Thank you, Surya. Goodbye. And thanks everyone for joining us here today on World Prematurity Today. There are many people live on YouTube and our Facebook page. Really, thank you for sharing your insights and your comments and your stories. I want to thank our entire team here at CPBF, our volunteers, and all the amazing speakers who joined this event today. It took weeks preparing for this special Preemie chats, and I do hope you've learned from them. We have laughed during the day today, we cried, and we got inspired by all the stories that we heard today, and the work of all the clinicians and researchers and ICU staff who share their work with us today is absolutely inspiring. It's also a day for us to show our gratitude for the work that they do for our families. And I want to thank our presenting sponsor, Pampers Canada, for supporting today's event and believing in our vision of a brighter future for all premature babies and their families. And if you missed our announcement today, Pampers, we have a collaboration with Pampers, and every time you use the hashtag Pampers for Preemies on your social media and or purchase Pampers Swaddlers at Walmart Canada from November 17th to December 17th, Pampers will donate 40 cents to the CPBF Parent Care Program, which is our mental health support program for families. And tonight, 40 landmarks across Canada are lit up in purple in honor of 30,000 babies born prematurely in our country and 15 million babies worldwide. Check our website, canadianpreemies.org, to see if a landmark near you is participating. And CPBF is a charitable organization, and we believe that together we can support more families. Please consider making a donation. Thank you all for joining us on this World Prematurity Day, and I see you again on Friday, 1 p.m. Eastern Time on our weekly Preemie chats. Take care, everyone, and stay well.